Hello, everybody. Welcome to our webinar on dental implants and sedation. I'm Olivia, and I'm excited to be guiding you through this informative session today. Whether you're exploring options to restore your smile or you're seeking clarity on the process, you're in the right place. Today, we'll delve into the transformative world of dental implants, answering common questions and showcasing how our advanced techniques can help your journey be comfortable and rewarding. Today, we have the pleasure of speaking with Dr. Robert Amirian, a well-qualified and experienced dentist who's been specializing in dental implants for over 15 years. Dr. Amirian's commitment to patient care and his expertise in dental implants makes him a trusted authority in the field. Whether you're brand new to dental implants or you're looking to deepen your knowledge, you're in excellent hands. Dr. Amirian, thank you for being with us today.
Well, thank you so much for your kind words. I really appreciate that. Thank you. And it's really a pleasure to be with you guys all. I'm really excited about this webinar to inform you and give you a lot of feedback on different type of implants and misconceptions about implants. And so it's a pleasure to be here. Thank you.
Awesome. What are some common misconceptions that you encounter about dental implants?
That's a great question. So we get a lot of different misconceptions about dental implants. One of them is that it's painful. The other is, am I too old to get dental implants? I'm already very old. You know, what's the whole point of getting dental implants? Another misconception is I was told by my dentist that I can't get dental implants because I don't have enough bone structure. Other things I've heard of is, oh my God, you know, these are very expensive. How am I going to afford dental implants? So a lot of different misconceptions I really look forward to getting into today.
Great. Well, we can start with the most common question, which is why would a patient consider getting dental implants?
Absolutely. So there are a lot of different reasons where patients may want to get dental implants. One is missing teeth. They're not able to eat properly, chew properly. They've just been missing teeth for so long, and they need a better solution. Using dentures, and they're not able to eat with the dentures. They slip and slide. They're not able to use the dentures properly. A lot of different reasons that we have patients come in and they ask us, hey doc, I just hate my smile, I hate the way it looks, can we just get a whole new set of teeth put in? I'm not happy with the way my teeth look. So varying reasons, but most patients when they come in, we try to find out what exactly it is that they need help with.
That sounds like it could potentially be a painful procedure. Is it painful?
Not at all, not at all. So dental implants, what's great about them, that we have technology now to make them really comfortable for the patient. We're able to use all different modalities to really have the patient comfortable, like IV sedation, which is a really good option for patients who just don't like going to the dentist at all. Sedation is a way to give patients the ability to be put to sleep. They can sleep through the procedure, it's done, they wake up, and it's all over. Another is we also utilize a lot of local anesthetic. We're able to numb the area really comfortable. The good thing about dental implants is they're not as painful as, let's say, getting a tooth extraction done. Tooth extractions could be a little uncomfortable if there's an infection. Well, with dental implants, because there's no infection, it's a lot easier to get done. Also, a lot of patients ask me, is it painful after the procedure? The good news is that we have different technology and medications now where we can prescribe to the patient where it's seamlessly not painful at all. We are able to control the pain after the procedure. A lot of my patients come back and they say, Doc, I can't believe this. How is this possible? How is it that I got a dental implant and it was not painful at all? So we like to really educate our patients on how we can make that really easy and simple for them.
Great. So are all dental implants the same? Like if you were to go to a different practice, would you get the same product?
It's a great question. So a lot of patients ask me that question. Hey doc, like, you know, why is there differences in price? Why are there different dental implants? Why are there, why is one office maybe more costly than others? One of the things we've been doing for the past 15 years is customizing the dental implants. So a lot of people don't know this. There's a difference between custom implants and machine-made implants. Difference is custom-made implants are fit for the patient's mouth particularly. Okay, so machine-made, they're one size fits all. We don't believe in that philosophy. We find that those typically can break or come out. We like to utilize as customized as possible. So the great thing about customized implants, again, they're made just for the patient's mouth. Sometimes the generic ones, the ones that are not really made for the patient's mouth, can break or after a few years break down. Sort of like when you buy a charger for your phone, if you buy the generic ones that are not really made for your phone, what'll happen? They'll break. They'll maybe last you a good year or maybe even less than that, and then you have to kind of replace them. So we don't want to do that. We don't want to use anything that's like a phone charger that's going to break down on you. We want to make sure that we use a really good customized product that's going to last a long time.
So what sets your practice apart when it comes to the cost of dental implants?
Yeah, so what we'd like to do is we like to offer all sorts of different payment options for patients. Anything from payment plans that can be done on a monthly budget. A lot of patients, obviously it's a costly procedure, so we want to make it as easy and comfortable for the patient as possible. So we can either offer financing, they can pay it off as long as 5 years on a monthly budget if they want to go that long. We have all different sorts of options for the patient.
Great.
Another question we get is, does my dental insurance cover dental implants? So the good news is that we have a whole team that specializes in insurance verification. So what they'll do is they'll find out if your insurance plan does cover dental implants, and if they do, we'll help you maximize that. Most dental insurances don't cover dental implants, but if they do cover it, we'll apply whatever maximum amount of dollars that's available to you to your dental implant procedure, save you as much money as possible on the procedure.
Great.
So keep in mind the initial consultation and the x-rays are at no cost. So we really want to do that to help extend the consultation to patients to come in and kind of meet us and kind of answer the questions, find out a little bit about what it is that they want and help them through the process. So the consultation is complimentary.
So I've heard of two different options, Snap-on implant dentures and permanent implants. What's the difference?
Great question. So Snap-on dentures are a great benefit for patients who already have dentures. Patients who tell me, you know what, I have dentures, they're just not very comfortable. I want to have something that I can use where I'm not using any more denture glue, where I can chew a bit better. That's a great option. Here's a sample of a Snap-on denture. You can see here, this is the denture, okay? And inside the denture, there are little clips. You can see those little clips there. And in those little clips, and this would be where the implants are. You can see where the implants are. What's great about this is that it snaps in. The denture actually snaps into the implants, and that holds in. That way it avoids this denture from slipping and sliding, and it's very firm, and it stays in place. This is, again, is a great option for patients who are already wearing dentures. The next option is something a little bit more firm and feels a lot more like your natural teeth. These are for patients that already maybe have teeth that have to come out due to periodontal disease or gum disease, or just missing teeth, and they want to make sure they have something more permanent. As you can see, they're very natural looking. They're made of porcelain zirconia. You can see that they're made of a really nice natural material. And what's great about them is they're permanent. They stay in. You can see that they're put in and they're placed in and they don't come out. They're permanent. And they feel just like natural teeth. And you can bite into apples. You can bite into steaks. Whatever it is, they feel stronger than your own natural teeth.
Wow, that's awesome.
So again, Snap-on dentures are a great option for patients who already have dentures that are looking for a little bit of an upgrade, something a little bit more stable. Again, I would not recommend them for anyone who has never had dentures before. They're not the best option if you've never had dentures before. So I would say is definitely if you've never had dentures before, go with the permanents. They'll do a lot better. You'll chew a lot better and feel a lot better about your smile as well. Can we roll actually to a clip? We have a patient that we're really proud of. She's amazing. She did incredible through the procedure. When she came and first saw me, her name was Sandra. She was really kind enough to do a clip for us where she was able to give us a testimonial. She really did this to help patients like yourself who just maybe are scared or not sure about what they're going to be getting with dental implants. So she was really sweet and did this video for us. Again, when she came to me, she was not in good shape. We really wanted to help her. She hadn't been to the dentist for 20 years. Wow. Literally, her teeth were actually falling out of her mouth. She was not in good shape. And so we were able to help Sandra, and she was really kind and sweet enough to do this for us. She was on the verge of being depressed, actually, but we were able to kind of turn things around for her. She's smiling ear to ear now. She's just can't stop smiling. Can we actually roll to that clip? Can we just go to that clip? That would be great if we can just show you a little clip of Sandra.
Hello. When I came to the doctor's office, my teeth were falling out of my mouth. And after I did the implants, the surgery went professionally successful. And when I woke up, the implants were in my mouth. I expected to be in pain, but there was no pain. There was not much swelling. And moving forward, I am very pleased. I'm very excited. And the job was excellent. So don't be afraid. If you need this operation, move forward. You will not regret.
Thank you. Thank you, Sandra. Beautiful smile.
Wow, what an incredible result. Did she have the Snap-on dentures or the permanent?
Yeah, she was really sweet. We actually did the permanent implants, which she did really well with, and she's essentially going out with friends, having dinners. I mean, she's telling me, she can't stop telling me about all the dinners she's having with her friends now, and I feel really good about it.
That's
I mean,
amazing.
it's really rewarding. That's really what it's all about.
Totally. So how does sedation play a role in the dental implant process, and what do you offer?
So sedation is an integral part if you fear the dentist, if you have anxiety with the dentist, if you're just not good with needles, it's a great option. So we offer all sorts of different sedation modalities. We have IV sedation, which is we put an IV in, we give you medications that really put you to sleep through the procedure. Then we have anything from pill sedation, where it kind of just reduces the anxiety a little bit, gets you a little bit more comfortable, so you can get through the procedure. Then we have other things like laughing gas, which is nitrous oxide, and those do really well as well. Really, our goal is really to provide a stress-free, anxiety-free experience for our patients. Our number one priority philosophy is to make sure patients are comfortable. So we want to make sure that's the case.
Folks, Dr. Amirian has a very generous offer at the end of the webinar, so make sure you stay tuned for that. Dr. Amirian, could you tell us a bit more about why you're extending this offer?
Yeah, we really believe in not impeding any care to our patients. We want to make sure there's no barriers. So the offer that we're going to provide with you is something to just give back a little bit, try to make it a little easier for our patients who have just been avoiding the dentist because of financials. So we want to really make this as easy as possible.
Can you explain what immediate implants and same-day teeth mean for patients?
Yeah, so what we do is we have a specific technology now where we can help patients have teeth the same day. We get a lot of questions from patients like, oh my God, if you take out my teeth and put implants in, what am I going to do? What am I going to go home with? The good news is we have the technology to give you teeth in the same day. What that means is when teeth are extracted and implants are put in, we're able to put temporary teeth in the same day with the technology that we have. The temporary teeth are made prior to the surgery, so that way they're customized to fit the patients, and it's basically a smile makeover where we can give you the teeth the same day. We're really proud of that. Not too many offices are utilizing that technology, so we're really glad and able to provide that for our patients.
That's incredible. So how long does the entire process take from the initial consultation to the final restoration?
It's a great question. So it varies patient to patient. Some patients it can be as quick as 3 months. Other patients can be as long as 12 months. But during that time, we'll never leave you without teeth. Okay. Typically, on average, we're seeing anywhere from 5 to 7 visits on average.
Can you elaborate on the advanced technologies that your practice uses for dental implant procedures?
Sure. We do is, as I mentioned before, we utilize same-day teeth options. So what we're able to do is we're actually able to do the surgery on the computer first. So before the patient actually has a surgery done in their mouth, we do it on the computer. It's a trial surgery we do. That way we get really good results in the mouth, because the better we plan this, the more planning we do prior to surgery, the better results we get. Like less swelling, less pain. The surgery goes a lot faster and smoother. So it's a benefit to our patients to utilize the technology. It's sort of like when a GPS system on your phone, when you're trying to get from point A to B. Many years ago, we had to use maps and had to kind of sketch and figure out point A to B. Now you have apps on your phone. You have Google Apps, you have Apple Apps, whatever it is that you use to get from point A to B, tells you exactly how to get from A to B. That's what we do with dental implants now. We're able to plan the surgery on the computer and know exactly where we're going to have to go from start to finish to get really good results.
Amazing. So are there any age restrictions or any health conditions that might restrict someone from getting a dental implant?
It's a great question. So there are no age restrictions. I actually have patients in their 80s and 90s getting the procedure done. The reason they're doing it is because they want to live longer, they want to live better, they want to live healthy, they want to be able to eat the food comfortably. And we are seeing that. Research is showing that patients are living longer because when you're happy, when you have a better lifestyle, when you're able to enjoy your food, you're able to chew comfortably, get out of that funk like Sandra was in, you do live longer. You know, there's a lot of research on the mind and the body and how they're connected. So I would say it is an investment, and we want to help you with that investment to make sure that you have a good long-term result. So there are no age restrictions.
Great.
All right, I would really want to invite all of you to ask questions. More questions, the better. I love questions, really helping patients answer those questions. So can we actually go to some questions maybe now? We can go to that. Can we go to that now? Great. Let's go to some questions.
Okay, so it looks like we have some questions coming in. Peggy from Flatbush is asking, I had a terrible experience at my dentist and they unnecessarily pulled my teeth and it was traumatizing. I'm afraid of implants, but I hate my denture. Can you help me? I'm so afraid.
Peggy, first off, let me say I'm so sorry that you experienced that traumatizing experience. You're not the first, you're not the last, unfortunately, but we can definitely help you. What I would tell you is that, yes, we can help you. I would suggest make an appointment. Consultation is complimentary. Come in, let's talk about how we can help you. As I mentioned before, our philosophy really is to make sure you have a good experience. Again, I'm sorry about the experience you had, but we'll make sure you have a really comfortable, good experience with us. And like I said, we have different ways to make this really easy for you. I would suggest come on in. The consultation is free. We'd love to meet you and see how we can help.
Okay. So Monica from Canarsie is asking, how do I know if I qualify for the payment plan?
That's a really good question. A lot of patients ask us that question. So we do have pre-approvals that we can do and help you either over the phone or when you come into the office. What we can do is we actually have easy payment plans that we can offer you. We can actually post a link on this in the chat that you can try to applying for if you want it. If you need help, you can give us a call. But there's a link that we'll provide for you, and you can see if you get it pre-approved. If you do, great. That's a first great step and to help you move the process along.
So it looks like Mike is asking, where are you guys located?
So we're located in downtown Brooklyn, right by the courthouses in Brooklyn Heights, conveniently located. We have all the different subway lines right by us. We're in downtown Brooklyn. We'd love to meet you. Come on down, and love to meet you, Mike.
So Mary from Crown Heights is asking, I'm a smoker and I have diabetes, and I was told I can't get implants by my dentist. What do you think? I hate my smile. Please help me.
Mary, first off, let me say, don't feel discouraged. Don't feel embarrassed. Don't feel ashamed. We can help you, okay? We have lots of patients that are smokers, diabetics, that have successfully had dental implants and are doing very well. One of the main things with dental implants and smokers is we want to make sure that we plan this properly with different medications, different protocols that we have, and I work very closely with your medical doctors with the diabetes to make sure that's under control, that the levels are good. We do all sorts of different consultations. I do myself. I reach out to your medical doctor, make sure your blood sugar is in control. And if it isn't, we can actually get it to a level that's acceptable for dental implants because we want to make sure that you have a good outcome. So I would say is, yes, don't feel discouraged. Come on in. We'll see what we can do to help you. And we have lots of patients that are smokers and diabetics that do very well.
Okay, let's take one final question. Karen from Park Slope asks, my teeth are in bad shape. I have bone loss and gum disease. Can I still get implants?
Yeah. Karen, probably 50% of my patients have gum disease and bone loss, and they're able to get dental implants. So the good news is, yes, you can get dental implants. What we do is at the time of the implant placement, we eliminate the gum disease. So it's all in one surgery. What we're able to do is we're able to actually remove the gum disease and place the implants at the same time. The technology we have now can do that. So we get really good results as long as the procedure is done with the right protocol. These are research studies that we've done for many years on how to do that. So the answer is yes, we can help you. We can eliminate the gum disease and do the dental implants and make sure that you have a good result.
Amazing.
And the great news is with the technology we have, we're able to rebuild bone. For patients that have been told that they don't have enough bone or that they're just have weak bone or the bone's not good enough, we have the technology now to help rebuild the bone. And that can be all done at the same time of the implant placement as well to really get good results.
Amazing. So as I mentioned before, Dr. Amirian is extending a very generous offer of $500 off your dental implant procedure if you mention the words webinar special for a limited time only. So make sure you book your appointments, and I believe you can book them online. Is that correct?
Yes, maybe we can share that link as well. We'll put that
course.
link on there. You can book online if you prefer, or you can give us a call, whichever you prefer. But easy way to book is if you want to go online, just click on the link and you can go ahead and schedule your consultation.
Great. So if you're ready to take the next step towards a healthier and more confident smile with dental implants, make sure to book your free consultation with Dr. Amirian. And don't forget that the $500 is a limited time only promotion. This was a very informative webinar. I certainly learned a lot. So thank you, Dr. Amirian, and thank you everyone for joining.
Thank you so much for having me, and I look forward to meeting you all. Thank you so much for joining us.
All the best.